Hi, everyone. Welcome back to the channel. Today, we're going to talk about fainting. What does it mean? What are the dangerous reasons that someone can faint? And what are the other reasons that can cause fainting? We use a word in the medical community called syncope, and we're going to talk a lot about it today. So, there are many different reasons that somebody can faint or pass out. Some of them are very benign, and we'll go through that together, but some of them are quite dangerous. Dr. Peter, when it comes to the heart, there are reasons that can cause you to faint that are related to the heart. What are those, and what are the very scary things that can be occurring?
It's so true, and that is such a good point, Ben, is that when people faint or pass out, it could be one of the scariest symptoms that you have, and one of the most difficult things to determine whether it's something dangerous happening or not. From a cardiology perspective, there are a number of things, obviously, that can cause people to pass out. Usually the final common pathway when people pass out is under perfusing or lack of blood supply to the brain. So what's happening is your blood pressure is dropping, you're in an abnormal rhythm of your heart, or something that's disrupting your blood pressure that can cause it to drop. And so from a heart perspective, I always say, picture your heart like a house, all right? And so you have the plumbing, the rooms, the doors, and electrical wiring. And so the plumbing is the blood flow on the heart. And so people can pass out when they have a blockage in an artery around the heart, which triggers an abnormal heart rhythm, which affects the electrical system of the heart, which doesn't allow the heart to pump appropriately, and it drops the blood pressure. Dehydration is a huge and really of epidemic proportion in people, especially I believe in the age of 60 onwards, is people just don't stay hydrated.
That's absolutely true. Yeah. Now, let me ask you, how do you know the difference? Like, what are some warning signs that fainting is something more than just dehydration, that it's something more serious? What might people notice about what's happening that's more serious?
I think changing the way we think about passing out in a sense is, and break it down into two ways. Is it something that you need to seek medical attention for right away? Or is it something that you could lie down and recover? And so anytime you have pre-existing conditions, I think is really important. And so if you have known heart disease, or if you're experiencing chest pain prior, blurry vision, or some type of neurological symptom, shortness of breath, and then pass out, is always a big red flag. As a cardiologist, I worry about people who pass out when they're sitting down. Because if you think about a lot of people, when you talk to them, and a lot of people out there, and you may have noticed that, is feeling light and dizzy when you get up, is because your blood pressure drops a little bit. That's called orthostatic hypotension. And that's blood pooling in the legs. You're dehydrated. You could be on medications that lower blood pressure. And again, you're not getting blood supply to the brain. But when people are sitting down and they pass out, it usually could be a rhythm trouble, like a drop in the heart rate where it goes really low, or the heart is beating until it pauses for a certain amount of time.
You know, they typically say that you should experience a prodrome or some sort of warning you're going to pass out. If that occurs usually more in a benign cause. So we use a term called vasovagal syncope, and you may hear this at some point. That means that you really were dehydrated or something bothered you. Some people see blood and it makes them pass out, or they get scared and it makes them pass out, or they ate something that didn't agree with and they pass out. But they get this warning. They get this feeling that they don't feel well. They feel lightheaded. They turn pale. They start sweating, and then they pass out. That usually is a more benign cause of fainting, and it's usually from factors that are going to allow you to recover. Fainting all of a sudden, no warning, all of a sudden, can be very dangerous. And that's where we start thinking about those heart etiologies, right? Like an arrhythmia, something really bad, correct? That can be really bad.
Oh, absolutely. It can be disruption of blood flow. It can be disruption in the pump, a problem with one of the valves of the heart, an electrical problem of the heart. But what it all comes down to, the final common pathway, is your blood pressure drops. And so what can you do to help yourself in a situation where you do have a prodrome? Maybe you were in pain or saw the sight of blood and you feel like you're going to pass out, or if you're in church standing up, which is really just a textbook classic example of that, is when people are dehydrated, they're in a warm, stuffy place, multiple layers of clothes, and standing up. and suddenly they break out in a cold sweat. They become pale to the onlooker. They turn gray and people, boom, they pass out. Again, we talked about it's your blood pressure dropping. And so lying down the ground, lifting your legs up can help return blood supply to the body. If you feel like you gain that prodrome, if you're against a wall, slide down and it can really help you to stop you from falling. Staying hydrated is so key.
Staying hydrated, it's absolutely enormous. I like what you said about going against the wall. I always say this to people. The vast majority of time that people get hurt, it's because they're running for a chair or they're running somewhere to try to sit down immediately because they feel like they're going to pass out. Don't do that. Slowly lower yourself to the ground if you feel like you're going to pass out so you don't fall and hurt yourself. If you're near a wall, put your back against the wall and slide down. That's the best way to protect yourself from an injury, because one of the worst things that can happen from fainting is getting a terrible injury. If you fall on your face, if you fall on an object that's sharp, you could get really, really hurt. So we do advocate that you get down to the ground as fast as you can before you don't have a choice anymore. So there are multiple dangerous causes of syncope. There are many more benign causes. Medications sometimes can increase your risk. Blood pressure medications you have to be very careful with. They can increase your risk of passing out. If you are taking too many blood pressure medications, this is a classic story. You go to your doctor's office, your blood pressure is a little bit up, but normally it's actually pretty well controlled. And your doctor gets nervous and puts you on a higher dose of medication. You go home and your blood pressure tanks and you pass out. That can be very, very dangerous. So you need to be very careful with your medications. You need to be making sure you're not on too many blood pressure medications. If you're on blood pressure medications, I highly advocate you have a blood pressure cuff at home so you can make sure that you're not getting too low at home, because your doctor often only sees your blood pressure when you're in the office. So it's very possible you're actually running a lot lower at home.
And I think if you see that you're on a lot of blood pressure medication, I think it's time to talk to your doctor and see, do you need to be on all those medications? Timing of medications is crucial. I can't tell you how important it is not to take all the medications at once. Take some in the morning, some at night. You will get not only better blood pressure control, you get less symptoms of fatigue, lightheadedness, dizziness, decreasing incidence of passing out. Medication side effects are tremendous. And again, one of those things like dehydration is so underdiagnosed.
It really is. Well, we hope you found this helpful. We try to educate you on things like this so that bad events do not happen to you. We hope very much that you're able to stay healthy. We will continue to do these episodes and try to talk to you about topics that you care about. So please comment below on things you want to hear about, and we will certainly do podcasts about those. Please check out our health and wellness store at ohiwellness.com if you're in the USA, or ohiwellness.co if you're in the UK. We produce products that we think will help you on your journey. Please come and see us again very soon.